Treatment Plan Project Case 8 by Angeline, Harris, and Rachel. Miss Six is a 29-year-old single African-American female. She is 5 foot 4 inches tall and weighs 150 pounds. She is single and works in a clothing store. Her parents divorced when she was 8, and she currently shares an apartment with her sister and mother. She is very well dressed and appears to take very good care of herself. She also does consider herself healthy, but has not seen a primary care physician. Her patient's chief complaint is that her gums bleed, she's sensitive to hot and cold, and she has a lesion on her tongue. After reviewing her vitals, her blood pressure was 138/89, her pulse was 80 beats per minute, and her respirations was 18 breaths per minute, putting her within normal limits. She has no functional limitations and considers herself to be in good health. The patient is not under the care of a physician or taking any medications currently and is reluctant to go despite her family history of diabetes, hypertension, oral cancer, alcoholism, and substance abuse. The patient admitted to smoking tobacco at a rate of 1 pack per day, presenting her risk for oral cancer, periodontal disease, increased hypertension, and xerostomia. Time for a quiz. Miss Six smokes 1 pack of cigarettes a day. Her blood pressure was 138/89, respiration rate was at 18 breaths per minute, and her pulse rate was at 80 beats per minute. What is Miss Six's American Society of Anesthesiologists physical classification? We'll give you a minute to answer the question. The answer to our question is ASA2. Miss Six is categorized as ASA2 because she is a smoker and her blood pressure was not within normal limits. ASA2 is classified as having mild systemic disease that does not interfere with daily activity.
Dental assessment. The patient's last dental visit was 1 decade ago for removal of the lower left third molar. The patient's oral hygiene consists of rinsing with phenol mouth rinse several times daily, but mixes it with water to reduce the burning sensation. She uses a medium bristle toothbrush once daily, never flosses or uses interdental aids, and is not sure if her toothpaste contains fluoride. Based on the patient's current oral hygiene care, we recommend that the patient uses a soft bristle toothbrush as it is more gentle, and we will also encourage her to brush and floss her teeth at least twice daily. Here is a copy of Miss Sig's FMX radiographs taken at this appointment. Oral assessment. Based on the EOIO exam, the extraoral findings were within normal limits. The intraoral findings presented with a white circumferential circulation on the left lateral border of the tongue, which the patient complained of pain during palpitation. Occlusal classification. The left canine presented with a Class 2 Division 1 due to the protrusion of the upper anteriors. The left molar presented with Class 1, and the patient presented with a 1 mm overbite and a 5 mm overjet. The patient's gingiva presented with pigmentation, which would be within normal limits due to her skin tone. Pathologically, the gingiva shows generalized redness, spongy consistency, shiny appearance, and soft texture. The area around the maxillary lateral incisors present with marginal redness, and the rest exhibits rolled borders as well as the lingual aspects of the posterior teeth. There is visible loss of stippling with blunted papilla. She did have a narrow maxillary arch and protrusion of central incisor teeth from thumb sucking or thrusting of tongue. This may be warrant to a consultation with the orthodontist if it becomes symptomatic or interferes with her wholesome facial image. Periodontal charts. The patient presents with 40% marginal bleeding index. Looking at the chart, the majority of the BOP bleeding occurs on the upper arch. Probing depth exceeds 5 mm seen on the posterior linguals. Patient's exudae presented within normal limits except for distal buccal of number 1 and buccal lingual of number 32. Based on Miller's classification, the patient is classified as Class 1 gingival recession. The recession is slight but not significant. The use of a medium bristle toothbrush may be one of the factors to her recession. Patient's AAP classification is Stage 3, Grade C, on the periodontal grading scale, which means the patient is at high risk of progression. Patient is classified as Stage 3 because she has interdental cal that is greater than or equal to 5 millimeters, horizontal bone loss that is 2 to 3 millimeters, and probing depth that is less than or equal to 6 millimeters. Another reason the patient is classified as Class C is because she smokes more than 10 cigarettes a day. The patient does not show any signs of frication, mobility, or mucogingival involvement. Here is our soap notes for today's appointment.
Question number 2. How many appointments will our patient require? A. 1 to 2, B. 2 to 4, or C. 4 to 6? Ms. Siggs will require 4 to 6 appointments according to our calculus code. She needs medical dental evaluation, referral to a specialist for the lesion on the lower left lateral border of tongue. She is Code 6 heavy and will require separate visits for each quadrant, reevaluation appointment after her last quadrant to assess her prognosis and home care. Each appointment will consist of a review of the patient's medical history, taking vitals to check for hypertensive status, then provide a pre-rinse according to COVID prevention protocols, an extra and intraoral exam, oral cancer screening, consent for treatment, post-op, and OHI will be provided. Appointment 1. We will have a full set of x-rays, probing, and hygiene assessment. She will be referred to an oral surgeon to assess the lesion on the left lateral border of the tongue and a medical evaluation due to her not having been to a physician for several years. An orthodontist appointment to assess her occlusion. The patient will also receive education on what home care products to purchase, such as an electric toothbrush, floss, non-alcoholic mouth rinse, in order to be more involved with her home care. Appointment 2. We will explain treatment and consent, smoking cessation counseling, and start her periodontal treatment. We will administer 2 carpules of local anesthetic of 2% lidocaine with epinephrine at a ratio of 1 per 100,000 parts, by way of posterior superior alveolar block and infraorbital nerve block in order to scale and root plane the most involved upper right quadrant. After scaling, we will irrigate the subgingival area with a 0.12% chlorhexidine gluconate antiseptic and give post-op instructions. Appointment 3 will consist of scaling the lower right quadrant, which is the second most involved quadrant, after giving 1 carpule of local anesthetic, 2% lidocaine, by way of Gao-Gates mandibular block. We will continue irrigation with chlorhexidine gluconate and post-operative instructions. Appointment 4. We will perform scaling and root planing of the lower left quadrant after local anesthetic administration of lidocaine 2% by way of Gao-Gates mandibular block. We will continue irrigation with chlorhexidine gluconate in the quad worked on and give detailed post-op instructions as before. Appointment 5 will consist of scaling and root planing the upper left quadrant after 2 carpules of local anesthetic with lidocaine 2% by way of posterior superior alveolar nerve block and infraorbital nerve block. After scaling, we will irrigate the subgingival area with chlorhexidine gluconate antiseptic and give post-op instructions, including addition to warm salt water rinses twice a day. We will continue to motivate the patient to participate in home care and get them ready to be an active participant in their oral health. We will see the patient for the reevaluation appointment in 4 to 6 weeks. Appointment 6. At our 4 to 6 week reevaluation appointment, we will perform a reprobation of the entire mouth and record descriptions of the tissue. This will give us a chance to determine the success of the treatment rendered and evaluate the level of home care the patient has achieved. Polishing of extrinsic staining with coarse grit Nupro paste to remove tobacco staining and an application of 5% sodium fluoride varnish to address her temperature sensitivity will be performed as well. We will recommend a 3-month recall for periodontal maintenance and reevaluations. This will conclude our presentation. Thank you for your time, and we will take any questions if you have any.